Thanks all of you for coming out. I'm John Strand, and as the City Commission's liaison for homelessness, behavioral health, and substance abuse, I can't tell you how excited we are for tonight's conversation. We have a panel of local experts who have dedicated their careers to helping vulnerable populations. As part of that panel, we have a guest with us from Milwaukee, Wisconsin. He has helped lead the Milwaukee area to a 45% reduction in homelessness since 2015. Milwaukee County is on pace to be the largest county in the United States to end chronic homelessness. The turnout we have tonight, all of you being here, it's proof that our city has a big heart. We don't want anybody left out in the cold. But the real question ends up being, how do we turn that love for our neighbors into action? Milwaukee has been seeing results, and James is going to share their successes with us. By listening and learning, I know we can apply these lessons here in Fargo. All of this gives me real hope that we can solve this problem together and through a metro-wide collaboration. Before we begin, I want to also thank our co-sponsor, Presentation Partners in Housing. They helped make this event a reality. And thanks to the Fargo Theatre for providing this absolutely beautiful space. I'm going to start off with a brief documentary and introduce James Mathy to the floor so he can introduce the film. Thank you.
Thank you very much for the introduction. Thank you. Appreciate that, Mayor. So just as we saw, this is the third session we've done on homelessness. And the turnout is about what the last two were. Thank you all for being here, the attention to this issue. A lot of excitement building with Fargo to really take what's being done here, put it to scale, do more than you have done before. But you have really good bones of programs here. Been able to meet with the mayor's whole team, Jan's whole team. It's exciting. So what we have is, it's just a 10-minute short documentary about some of our work. There's a filmmaker, Bigger Vision Films, Don Sawyer's his name. He did a film about it's called Under the Bridge, Criminalization of Homelessness. It's on Amazon Prime if you want to see it. Don would appreciate that. So he's from Indianapolis, and it was a documentary about individuals under a bridge doing things the wrong way, how things shouldn't be done. His mission was to flip that into a full-length documentary about the solution to homelessness. And this is just a small snippet from our work in Milwaukee. But that secondary film is going to be coming out in April. I begged him to be able to show it tonight. He would not let me do it because he's going to be debuting it in Atlanta in April, and maybe that will be at a theater like this after that. So it's really about going around the country, talking about what the solutions of homelessness are. It's some of our work, but also Houston, Texas. He went all over the country to take different programs to really teach everybody around the country how to do it the right way, turn it into a social impact campaign to make sure that communities can make progress and do it the right way using this method. So with that, again, just a short 9-minute film, and then we'll have a panel and discuss more of the details. So thank you very much all for being here.
Second grade teacher had me go to the nurse's station one year because I couldn't sit in the chair. When they looked up my shirt, they seen all the webs on my back. My mother had to put me butt naked with a stitching cord. I'm in the hospital, my auntie there, my mother there, the police is there, human services there, and I remember her telling them, if y'all not gonna take this enough, y'all get the hell on out of here then. And they left on out. Milwaukee right now, there's a lot of people that's homeless, that's built up a lot of this frustration and that anger, dealing with the verbal, mental, physical, sexual and all that, then they gonna stay in certain situations like this unless they get the counseling and stuff like that to deal with it.
Well, I've been homeless 15 plus years. I had a car before, I flipped up my car. I used to drive like 40 minutes to the wayside just to go to sleep. I slept at the courtyard. I slept pretty much everywhere.
I slept in the parks, slept in the parking lots. And I could sleep out there when we had a blizzard once. I got lucky because I ended up making it through that winter. Couldn't stay at the mission too much because I wasn't the type to be sleeping in a hospital gown with nothing on under it. That was their rules. So I didn't understand it.
Tell me a little bit about what it's like being homeless.
The administration of Milwaukee County, led by County Executive Chris Abley, there was the thought of what would it take to do something big about homelessness?
What would have to happen to eliminate the problem, not reduce it by 5 or 10%,
But end it. So he posed that question to me, went back to my staff, and started to think about what that would look like. One of the biggest things we could think of is what would it take to end chronic homelessness?
Needless to say, it doesn't take too much Googling around on effective approaches to homelessness to run into housing first.
So we came up with a plan to end chronic homelessness in 3 years, and that's what we presented to the county executive. It literally took one meeting where he said,
We're sure we can do this, right?
and if your answer is yes, I'm all in. And we said, yeah, we think we can do it. Two things we started with, we needed a lot of partners. So the first partner we were obviously going to reach out to was the city of Milwaukee.
The approach that we've taken here in the city of Milwaukee with the homeless population, I think can best be characterized as a partnership. We've had a very, very strong partnership with the county, Milwaukee County, with a lot of the agencies that provide housing or provide support, and we work closely with the police department.
First role I play is supporting Housing First and our community prosecutor.
If there was some issue that a person was facing in the criminal justice system, what we were engaging with the police department on was how to resolve that matter without rearresting somebody again.
We wanted to do this plan, and we needed business endorsement.
We are doing everything we can to have our city shine because, candidly, we're selling our city. We want visitors to come here. We want delegates to come here and spend money and create jobs.
For them, it was going to be a new approach, and our thought process was, we're going to go into a room with 100 businesses and tell them, we're the government, trust us, it's going to work. We needed to tell the story better. So that's why I reached out to Sam Sambaris. That made a big difference, because it wasn't just Milwaukee County saying, here's what we're going to try to do and we think it's going to work. We know it's going to work.
Dr. Sambaris, I think, had them mesmerized because this was an approach our community had never heard before.
The other thing that we did is staffed up our division specifically for this Housing First initiative. I hired an outreach services manager, Eric Hollenstein, and thank goodness I did. We wouldn't have done any of this without his leadership.
I created an outreach collaborative in the community, and so that brings together the DA, MPD, the Sheriff's Department, the Medical College, all of the outreach teams, including all of the volunteer outreach teams.
We wanted to be able to prove the efficacy of our model, so one of the other first positions we hired is a program evaluator to be able to show locally we can come up with the same data as we've seen across the nation. And then we hired 3 housing navigators.
We have a list of tasks that revolve around engaging with people who are literally outside in effort to help them be more aware of what their options are for housing and shelter. We do late night and early morning outreach because that's when people are most likely to be in their spots.
This is when we find the truly homeless people.
Yeah.
This time of night.
Homeless outreach, anybody here? How's it going? We're just running around checking on folks tonight, make sure everybody's okay. My name is Demir.
My favorite outreach worker is Demir. If it wasn't for the outreach people, if it wasn't for them, it's my first apartment.
Ever?
Yeah. I'm 38 and it's my first apartment.
This is a sanctuary for me right here. When I moved up in here, I was like, how long is this gonna last? They said, as long as you want it to. You can put stuff on the walls and this and that. I was like, yeah, right. This can end like here. So it took over a year before I thought it was permanent. These people that's out here trying to do this with Housing First, they are sincere about what they're doing.
It really is a good project to be part of. It really, really is, you know. These are good people out here. They really are. You know, a lot of them they've drawn the short straw in life, and they are survivors is what they are. They really freaking are, and I admire a lot of them for it. And I'm not just saying that either because I got a camera in my face right now.
I try now to give back. I'm on the COC board. I'm on the advisory committee. I goes downtown and I tell people, hey, get out of these streets. There's housing for people.
So if you are responsible to pay your heat, gas and electric bill, are you supposed to pay it? Yes.
Housing First, the model is here and it's clearly working. Our numbers are showing us.
When we started our plan to end chronic homelessness, we wanted to hold ourselves accountable that we were going to do it in 3 years. We were going to track that every 6 months, and if we're behind, we're going to figure it out. And although we're waiting for our HUD designation, we literally hit that almost to the month of 3 years.
As individuals look at this, they can say, here's a community that is genuinely trying to address this issue and has had success.
Government jobs, I spend a lot of time telling people in interviews, I'm going to set goals that are probably, harder than you may have had before. I'm quite sure I don't have enough resources to get you all the way there, and I'm almost certain I can't pay you as much as you probably should be paid. But you've got a different approach to doing something, and you show me that it can deliver better results. And hey, if there's some political resistance, as I always say to them, I'm not the wind behind your wings, I'm an effing hurricane.
If you're going to be in public service, you might as well kick ass at it.
All right. Thank you all so much for being here tonight. Some of you have been with us for all 3 events today. And I just want to take a minute to acknowledge the diversity of people that we have here in the Fargo Theatre with us tonight. I see some of my friends and family, some fellow service providers, some of our elected leaders, and most importantly, some of our unhoused community members. And so we're really grateful to have you here with us to experience this documentary and ensure that we're holding our community accountable to this goal that we're trying to achieve. My name is Chandler Esslinger, and I am the community liaison for Fargo Cast Public Health in the Harm Reduction Division. I'm based out of the Engagement Center just a few blocks from here. And tonight I have a really incredible panel who is going to help us understand a little bit about what we're doing in our community and what's possible. I'm going to allow everybody to just introduce themselves, and maybe we'll go this direction. So Jan, would you mind introducing yourself first, and then we'll just kind of go down the line here.
Sure, my name is Jan. I'm the Director of Harm Reduction Programs for Fargo Cast Public Health. So happy to be here and so happy to see so many people here.
Hello again, everybody. James Mathy, the Administrator of Milwaukee County Housing.
Hi, Pam Sagness, and I am the Executive Director of Behavioral Health with the North Dakota Department of Health and Human Services.
Bonjour, hello, my name is Ashley Littlewolf. I am the Self-Sufficiency Assistant Coordinator at SENDCAA.
And good evening, my name is Sarah Kennedy. I'm the Homeless Prevention and Diversion Program Director at Presentation Partners in Housing here in Fargo.
Awesome, thank you all so much for being here tonight. Yes, please, round of applause. So I don't know about you all, but when I am watching this documentary, I see glimpses of Fargo in the people who are speaking, the stories that are being told, even in some of the Midwestern backdrop that we see. And James, I'd love to start with you first. Can you talk with us a little bit about how Milwaukee decided what ending homelessness needed to look like in order to be successful?
Sure. So thank you for the question. So it was certainly about adopting the principles that you heard a little bit with Housing First, which is really moving an individual directly off the streets into permanent housing, not having to go through shelter, transitional housing, and what that looks like. So for us, it was starting to adopt that philosophy and kind of go from there. And it was also important, so we started discussions on ending chronic homelessness, but even more important than that, the accountability for us. Really what this is about is reducing homelessness. So there might be folks in the room that look at this homeless issue one way and the other way. What everybody can agree on is, imagine if we can hold ourselves accountable here in Fargo to reducing homelessness every single year and holding us all accountable for that. So that with us, that was our main goal and our main metric. To try to track that, so we had decreases every single year. This past year, we talked about this today, Fargo's seen an increase in homelessness just like Milwaukee has this year, just like every other community has. You have to pivot, you can't give up, you have to get back where you came from and make those adjustments. So for us, what this needed to look like is government accountability and community accountability for those annual reductions in homelessness.
Thank you so much, James. Yeah, nationally, we've seen a 12% overall increase in homelessness, which is the largest increase in homelessness that we've seen since data collection began on homelessness in our nation. I really want to talk a little bit more about why starting with chronic homelessness. So I'll give this to James and Jan. James, maybe talk a little bit about why Milwaukee started with chronic homelessness specifically, and then Jan, we can talk a little bit about why that matters for our community.
Sure. So again, for individuals that are chronically homeless, that's going to mean individuals who have been homeless the longest, and most likely individuals that are dealing with a lot of trauma, acute mental health issues, addiction issues. So for us as housing and homelessness providers with our mission, that's naturally what we're going to focus on. But even from a community perspective and even a taxpayer perspective, this was a population that was using an awful lot of emergency services, going in and out of the criminal justice system when they really didn't need to be there, going to emergency rooms for basic care issues. We were able to demonstrate a very significant cost increase for taxpayers and local taxpayers by focusing on that population, getting them into housing, instead of being homeless for even longer. So for us, it was certainly just part of our mission, seeing those individuals who were the most needy, who have been homeless the longest, but also individuals that are using a lot of emergency services and those different types of things, and also a population of individuals that were consistently in our downtown area, which is really what started the conversation for us with our business district and working together. Because it is oftentimes in most cities in the country kind of a downtown issue. So that's why we started with chronic homelessness. Jan, can I turn it to you?
Sure. I don't have a lot to add to that. That's a great answer. I think that the one thing that I really want people to think about is how vulnerable the population is. Those folks that meet that definition of chronic homelessness have been unsheltered often for long periods of time. They're facing all of the different health complications that come with homelessness, and they're most likely to die outside. And we know it costs far too much to do nothing, and James has spoken about that so well. But it also, there's this human toll, right, that comes with it. And I just don't believe that this community is okay with that. I don't believe that this community is okay with having some of our neighbors just live outside and exist outside. Thank you.
I think I really appreciate those comments because, you know, folks who are experiencing chronic homeless really are the most vulnerable in our community. And what it sounds like is when you're able to end chronic homelessness, it really sets the stage to be able to iteratively end homelessness for different populations of people. If you were at one of our events earlier today, James also talked about how Milwaukee has been successful in ending chronic homelessness through their partnership with family homelessness and through their partnership with United Way, and just how crucial ending chronic homelessness was in taking that first step to then end homelessness for other populations as well. So James and Jan again, I would love for us to talk a little bit about what does it mean to end homelessness. Can we define for the community what ending homelessness means so that we're kind of all on the same page?
Sure. So for us, the mention about ending family homelessness, so our area through United Way's leadership, it wasn't Milwaukee County's leadership, it was United Way, we were able to declare the end of family homelessness in 2023, which was using federal definitions, and there's 58 different criteria to be able to do that. But it led to a lot of good community conversations about this question and what ending homelessness actually means. So does it mean if Fargo ended chronic homelessness or we ended family homelessness that you're never going to see a family sleeping on the street again? That's not really what that means. What we're trying to do is build a system where homelessness is brief and episodic. So if an individual or a family is homeless for 1 or 2 days, what is that plan and a quick intervention to get them off the street into housing? So it's more about brief and episodic homelessness and doing it as quickly as possible, and in a perfect world from an unsheltered situation directly into their own apartment and skipping all those steps in between. So when we talk about ending homelessness, that's what our system looks like.
I think that that's what our system would look like too. I believe that we can end homelessness in this community, but it's important to acknowledge that that's not the finish line, right? We don't like reach this benchmark and then homelessness is over and we all move on. We have to take all of the tools, all of the support that we can find and keep doing those things that we know will work or start working, and keep everything intact, keep supporting people, and just keep proving, I think, to the community and to those folks that end up without a place to live that we do have the tools and we have the will to address this effectively and just keep going.
Yeah, in some ways, ending homelessness, that's when the work really begins to maintain that status in our community. Our local FM Coalition to End Homelessness really does define ending homelessness as that rare, brief, and one-time experience. So that's kind of the vision that I think we all share. James, I'll have one more for you, and then we'll open it up to some of the other folks. But one of the things that we know people are concerned about in our community is the growing visibility of unsheltered homelessness, especially with this drastic increase that every community has been seeing. And a lot of times that unsheltered homelessness looks like encampments. Can you talk about what Milwaukee's approach to that visibly unsheltered homelessness was?
Sure. So our homeless encampments years ago were in our downtown district, one very, very large one. Up to 90 people were in our downtown district in our large encampment. So it was really this collaboration between Milwaukee County, the business district downtown, the police department, and our district attorney's office. Everybody downtown was very, very frustrated about that. But what everybody agreed to with this Housing First philosophy is give us time to house everybody and not just shelter, but actually permanent housing. Let's all work together to figure out how long it's going to take, and we will set a date where by X date, the encampment will be cleared, but it's not going to be the criminalization of homelessness. We're not going to be ticketing individuals. We're not going to be forcing them to pack up to go somewhere else. Give us the time we need to house individuals, and then have a date where that encampment is gone, and then conversations with urban planners in the city of Milwaukee to say, you know, what is this space? It's a dead space in downtown. What can we reimagine this space to be? They took that area, completely redesigned it. Again, they didn't kick anybody out. We housed everybody, and then they kind of enforced that space afterwards where there was no individuals there. Turned into public spaces, a dog park, a walking park, those different types of things. But the police department never forced anybody out of situations. All that does is move homelessness from one area to another. So they gave us the time we needed to find housing. But again, after that, they were able to activate that space to some really great, just general public usage in that area.
Thanks. Jan, is there anything that you maybe wanted to share about what addressing encampments or unsheltered homelessness has looked like in our community so far?
It's been a challenge, and I think it's something that everybody's learning from as we go. I do believe that that we've thrown enough Band-Aids at things now that we know we have to work towards solutions. That the encampments that people have seen, the people camping along the river, for example, near downtown, that's a symptom of a much bigger problem. And that problem is the rising number of unsheltered people. again, that's happening across the nation. In 2020, the number of unsheltered people surpassed the number of people in shelters. So it's certainly a crisis, and it's not going to get any better without some solutions. And again, that's something that we're working on, and I believe we have what it takes.
I think, James, you were mentioning to me earlier that even if somebody attempted to maybe camp again in the downtown area, it was kind of just like, would you like a house instead? Like, can we just do this instead?
Yeah, so it was really about kind of this trusting relationship between us and the police department. So once there are no encampments in downtown Milwaukee now at this point. So if an individual was unsheltered downtown, especially in that space that's now activated for public usage, we have a downtown outreach coordinator that's within our government division that's funded by our downtown business district. So any downtown business or the police department, they call us first, and we can get there within an hour and we can deal with that situation. And again, the police are not gonna say, you know, if you don't leave in 5 minutes, you're gonna get a ticket. But it's, you know, sorry, you can't sleep here in this public space. There are services for you. We're gonna call Milwaukee County. They'll be here in a little bit, and the police will stay there till we arrive. And again, it's enforcement, so to speak, but it's never a criminal issue. It's never a ticketing issue. And we're able to respond really, really quickly. And again, working with our business partner, they realize that once somebody is in permanent housing and getting the services they need, they're no longer homeless. And we don't have to have these conversations, but they really relied on us to be first responders. The police didn't want to have to be first responders, but businesses wanted an immediate solution and immediate contact. So we were able to lead that charge instead of it being a law enforcement, criminal justice type issue.
Thank you so much. One of the things that I think complicates people's feelings about unsheltered homelessness, and one of the things that we hear a lot in our community is that this stereotype that everybody who is homeless is addicted or mentally ill, and that's what's causing their homelessness. Jan, can you talk a little bit about how we try to respond to that narrative and the lived realities of the people we serve?
I can. First of all, people are homeless because they don't have anywhere to live, and that is just flat out the only reason that they are homeless. We have a lot of people in our communities everywhere that have faced the challenges of substance use and mental health, and they're not homeless. These are not the things that are causing homelessness. However, they can make it really complicated to get out of that situation if they're left untreated or if there's unresolved trauma and so on. So I don't know if we can ever get away from that stereotype. I think that some of that's always going to be there. I think the best way to get away from it, I guess, is just make sure everybody gets housed, and then we don't have to wonder if they're mentally ill or using substances, right?
I love that answer. Pam, I'm going to turn it over to you. Pam introduced herself. She works directs the entire behavioral health department. And one of the themes that has come out of James's presentation is housing as a form of healthcare. And I'm curious if you can talk a little bit about the role that housing plays in maintaining someone's behavioral health and well-being.
Certainly. First, I just want to commend everyone here. It's so exciting to see such a turnout and such a focused effort at the local level. To hear all day from the mayor, local leadership, and the work that you guys are doing is really phenomenal. But I think it's so important that we continue to work on the behavioral health aspect that we've started in North Dakota, which is stopping our treatment of behavioral health as something that needs a punitive response. At any point in time, 20% of adults in North Dakota are struggling with a mental illness, and 5% of adults in North Dakota at any point in time have a chronic mental illness. And so changing the way that we treat behavioral health is key. Housing is a very important factor that impacts not only individuals that are already housed, but are at concern of being able to make rent and be able to stay housed and be able to keep their children safe. But we also have many individuals that once they have housing, they don't have the skills and the tools in order to maintain that housing. And so being a partner in behavioral health is really important for us in order to bring our resources together to be good partners to each other and to recognize that behavioral health needs to be treated on an equal footing with physical health, and that we don't blame people for the illness that they're struggling with, but instead recognize that there's ways we can really partner to address that. So one of my main things, again, would be coming back to behavioral health really being treated on an equal footing with our physical health.
Thank you so much, Pam. I want to make sure that I'm opening this up to our other panelists to respond to some of these questions as well. So please, as we continue on with the questions, if there's anything that you all would like to add, I know you all have lots of experience recognizing the role that housing plays in maintaining an individual and a community's health and well-being. Pam, though, to kind of elaborate on your answer, can you share with us a little bit more about the State Department's vision for what behavioral health services will look like in Fargo in the future?
Certainly. You know, I think one of the things that's been really exciting for us is that we have a true partner in Fargo and the surrounding area, in that we've been able to collaborate on projects together, and whether it's the Mobile One project and looking at engagement services, withdrawal management. There's so many things that we've been able to partner on to try to change the way that we address behavioral health in our state overall. I think one of the things that we would have as a goal is that we need to have accessible behavioral health services at the time when they're needed. And we know that we have significant gaps in our system, whether you're living in an urban area of the state or you're in our rural areas. Everyone has significant gaps. And so one of the things that we really need to do is be able to get very specific in how we address those issues. So for example, long-term stability. How do we make sure that we have recovery support services that are available? We've been able to look at expanding our workforce by really doubling down on peer support and recognizing that people with lived experience can connect with people in a way that those who don't have that lived experience often can't. And so we can continue to work on our career ladders and ensure that those services are available, but that's number one. When someone has a behavioral health need, a 2-week wait is not okay. And those are the things that we need to be able to continue to address, and it goes hand in hand with housing.
I think that's one of the things that we spend a lot of time thinking about, is how do you make sure that an individual and a community is getting the right level of care at the right time, and just continuing to make that investment. So we'll keep coming down the line here. Ashley, I would love for you to talk a little bit about, as the board chair for the Coalition to End Homelessness locally, what are some of the strengths of our local coalition that you feel kind of set our community up for success to tackle this big issue?
Yeah, absolutely. I also want to echo what Pam said. It's so cool looking all day today, seeing all of partners in crime, all of the partners that we work together with on a daily basis, kind of doing the mundane stuff, and the energy is just amazing. So I look at the FM Coalition strengths to end homelessness as the hub. For over 30 years, the Coalition has been bringing all of the partners together to collaborate. When I entered into being a service provider in 2017, that was my first education to what the homeless response system looked like in the community. And I'll never, I take that education with me and carried it throughout the years. And so the focus on education, advocacy, and collaboration, those are the 3 top strengths and focus areas of the Coalition. And what I referenced is doing the mundane work and being boots on the ground. As service providers, we might not have all of the time in the world to do advocacy at higher levels and to dedicate a lot of time to that. So I think the Coalition has historically and continues to do a great job at advocating at the various levels and showing up and listening, involving service providers and partners, and taking that feedback and trying to involve lived experience into the decisions and the advocacy efforts. Bringing together all the partners that are involved in the response system too, I think is important and a strength. lovely, wonderful, great humans that are doing the work, we have lots of rules. We have lots of guidelines, we have deadlines, we have caseloads, we've got capacity issues, but people show up consistently to monthly coalition meetings to learn updates, best practices, advocacy, to be connected and to be able to look each other in the face and say, like, you're tired, I'm tired too, but we're still fighting in this fight together. So bringing everybody together and advocating for best practices, I think.
Thank you so much. I really deeply love our coalition and the work that we do. And if you're sitting out in the audience and you're kind of wondering, like, maybe what's my role? How do I get involved? If you're a service provider, we have some wonderful committees, a part of our coalition, that we would welcome you to join. Those are playing a crucial role in really embedding some of these best practices within the homelessness response system. And if you're a community member and you're not quite sure, the advocacy committee would be a wonderful way to get involved and really understand what we're seeing as service providers in our community. I wouldn't be able to do the work I do every day if I wasn't listening to all of the lived experiences of our coalition members. If we weren't collaborating at the level that we do, we wouldn't understand what other shelters are experiencing or some of the capacity issues that we have. So I'm just deeply grateful for our local coalition. I want to pivot a little bit and Sarah, get you in on this as well. So Presentation Partners in Housing has two really unique programs that support our entire community, and I'd love if you could share about the role that prevention and diversion plays in ending homelessness, and maybe kind of unpacking for our community members what prevention and diversion kind of means and looks like.
Absolutely. When I talk about homeless prevention, I really think about the homeless response system, and I picture it as having a front door. So when people are at that critical point in time where they're on the verge of losing their housing, they can knock on this door and essentially be met with a professional problem solver, of which we have many in our community, who really think creatively about how to prevent the loss of housing in the first place, knowing that affordable housing is an issue. It's hard to get into housing. When we see vulnerable individuals and families get into housing and then miss rent or have some kind of health crisis and they're facing eviction, it is just crucial that we prevent them from re-entering the homeless system again and again and again. It's the cost-effective thing to do. So homeless prevention work is kind of a variety of interventions, but in this community and amongst many great partners we have in this work here in Fargo-Moorhead, it really comes down to eviction prevention and working with those housing providers, trying to come up with solutions to keep people in housing, especially if there's somebody who has a long history of homelessness and frequent service utilization, and they got into housing and have a housing voucher. If they become evicted and become homeless, they'll lose that voucher as well. And that shadow of eviction just tends to follow them and make it that much more difficult. So we talk about, if people become evicted, they oftentimes are sentenced to the street because of it. It just sets a domino effect. It's more cost effective to provide a little short-term rent assistance and the right kind of support at the right time to keep people in housing that's safe and suitable for them. Kids get to stay in the same schools. It's just better for the individuals, the family, and the community. So that's a little bit about prevention, and then diversion is just kind of an offset of that, where prevention works with people who have housing but are on the verge of losing it. Diversion works with people who are, new to homelessness and, might be calling us because they're seeking a shelter bed, which, spoiler alert, there just never is. There's wait lists for the shelters. So an alternative approach is to work with that individual or family to identify possibilities for short-term stay with friends and family, helping them communicate with family members maybe they haven't talked to in a while, providing them some resources so that they can stay even for one night, a couple of nights, a week. It just helps us buy time while we work with them to identify a more long-term housing a permanent housing plan, and then get the supports together to help them get into that, so they can kind of bypass the emergency shelter system. That decrease or that slowing down of the inflow into the homeless system makes it more possible that for our the emergency shelter beds we have in this community can be utilized by people who truly have nowhere else to stay. That's kind of our goal with prevention and diversion.
Perfect, thank you so much. And I think it's important for all of us to have a little bit of literacy around some of the terms that we use in the homelessness response system. And when we talk about ending homelessness, you know, the housing first approach that James has really been sharing with us throughout the day is the way that we maximize the number of people entering permanent housing. And the role that prevention and diversion plays is minimizing the number of people entering the system altogether. And you really have to have both of those pieces in place in order to kind of end homelessness and make it this rare, brief, and one-time experience that we have as a vision for our community. Sarah, again, I would just be very curious, knowing what we know about the current state of our community. Shelter beds are full, people don't have places to go. What are some of the trends you're seeing in the data or the number of calls that you're getting, the number of people you're helping in the community? What does that look like kind of over the last few years?
Yeah, it's been an interesting ride with some changes that have happened because of COVID and available funding. I guess this probably won't be a surprise to most people, but one of the trends we see is just that gap in affordability. What used to be affordable, the kinds of incomes people used to be able to get their hands on, and the rent they could afford. You know, rents are going higher at a rate much faster than people's income, especially people that we work with who are the most vulnerable, just have an income ceiling that maxes out and can't keep up with those rising rent costs. So things like housing subsidies, vouchers, that helps kind of bridge that gap. During COVID, our community got flooded with some great resources that really helped make sure we could help as many people who came to the door as possible. And with those dollars just drying up real fast, we were always worried about this eviction tsunami that was coming, but that was kind of stalled for a little bit with all that additional funding, and now it feels like it's here, it's happening. We see it, you know, like James mentioned, other communities, numbers Fargo is seeing, and that rise isn't unique, you know, especially to Fargo. I was looking at, you know, the maximum Social Security benefit that an individual can earn right now is $943 a month, and fair market rent for a one-bedroom is $781 a month. So that leaves them $162 of money to spend on everything else they might need. So we talk about households trying to be within 30% of their income paid towards rent. A lot of the people we work with are just way beyond that, paying a majority of their income towards housing. So one car breakdown, one missed job, a missed paycheck can really send people in a different kind of trajectory. We know from some of you know, in this community we have a housing crisis line that we can help people when they call in, and we've worked with over 4,000 people in the last year, unduplicated households seeking assistance during a crisis. 66% of them are households who have income, they just don't have enough income to stay on top of their housing bills.
One of the things that I've heard said when we're talking about the affordability or the lack of affordability, for a lot of families, rent eats first. And so if your rent is the bulk of your expense and it takes up the majority of your paycheck, there's nothing left. When we think about prevention and diversion, another thing that comes to my mind is the role that anti-poverty programming plays. Things like what Community Action does, our local community action agencies, CAP-LP and SENDCAA. Ashley and anybody else who'd like to chime in, I'd love to talk a little bit about the role that anti-poverty programming also plays in ending homelessness.
Anti-poverty talk is my jam, so we're gonna be here till like 9 p.m. I'll first talk about, so SENDCAA, I said that really fast in my intro, but Southeastern North Dakota Community Action Agency. A lot of people mess it up and say SENDCAA. It's SENDCAA as an acronym, but we are a partner in the CARES coordinated entry process. So we have dedicated housing, rapid rehousing, homeless prevention case managers that work quickly to get people rehoused as fast as possible, or prevent them, similar to what Sarah was talking about, prevent them from ever entering homelessness, because it does cost the community, it costs that family a lot more money if they do get evicted from their current housing situation, and then that barrier of getting rehoused once they have that eviction, and that large amount of money and legal fees, past due rent that's needs to be paid up before a new landlord will approve them for an apartment. So SENDCAA, we're involved in the CARES process. We accept referrals for individuals that are identified as being most at risk or most vulnerable. And our team is dedicated to being housing first and applying that approach. The barrier that we face is affordability, like Sarah talked about. And the inflow that we are experiencing is, we don't have the capacity to meet that need, but we have the approaches, the dedicated staff to work with individuals so that they can maintain or obtain housing. So that's one piece of it. As an agency, SENDCAA is one of the largest two-generation whole family agencies in this area. And what that means is, so 2 generations, we have diverse programs at SENDCAA: Head Start, Early Head Start, Career Coach, Self-Sufficiency, supportive services for veterans' families. I'm missing about 20 other of them. But all of those programs, we can track outcomes for both adults and children in the households, and we measure, similar to the social detriments to health, like the improved overall well-being of the family, because this is continuing to gain traction across the nation as an approach that can disrupt that cycle of poverty. Because we know that kids who are experiencing poverty are most likely to be in poverty themselves once they're adults. And so if we can get in and provide supports and interventions, education, career coaching, whole family, housing supports, while the kiddos are young, we can improve the outcomes for generations to come and hopefully disrupt that cycle of poverty for that family and for many families. Yeah, I think that's it.
That's perfect. Yeah, I think one of the key takeaways is just recognizing the array of services that not only are available in our community, but are really necessary to wrap around an individual or a family in order to maintain stability and really improve the overall health and well-being of our entire community. So we're going to have some time for audience questions here shortly, but I want to kind of challenge our panelists to think about a future state when perhaps we've ended chronic homelessness. We're working towards our next goal. We've implemented housing first with Fidelity. We've hit the big time, right? What comes after? What comes after housing first? Where would you like to see our community go from here? And I'm happy to call on someone to start us off, but I'd love for somebody to be brave and start.
I'll start, because I feel like I ended really abruptly. But this is, as an Indigenous person, walking downtown any time of day, I see all my relatives all over the place that are experiencing being unhoused, and that weighs heavy on my heart, and professionally and personally. And so for me, envisioning a community where I can walk downtown and see my relatives, but they're working, they're housed safely, and we are challenging that narrative that's out there for those Indigenous families and relatives that are experiencing homelessness.
Thank you, Ashley.
I'll go next. So, can you guys hear me?
There we go.
So I would say, kind of what we talked about earlier today, so housing first is just the start of this. But I think what has to happen in Fargo is, and it took us a while to get here in Milwaukee, but My hope would be a couple of years from now, you all know what the solutions are and you're all working together. So there isn't enough federal money to do this. There isn't enough local money from the mayor's office to do this. It's going to take federal, city, county, your surrounding towns from Fargo. Everybody's got to be rowing in the same direction and understanding what that plan is. Your philanthropic dollars, your local foundations, your business district, everybody has their part to play, and none of it works unless everybody's agreeing on that one plan and all rowing in the same direction and doing it together at the same time.
Thanks, James. Yeah, Jan, please go right ahead. I know you've got a vision.
Okay, so, boy, there are so many things. I think that, first of all, that's a dream, right? I mean, don't we all want to be that community? The community that's done this with fidelity, and we don't have people homeless for months and months and years anymore. That's a dream for us, and it certainly is a dream for those people who are living that life. I think I certainly echo what the others have said about this. The piece that I am excited about, and I believe we can do a much better job with, and that we will do a better job with, is making sure that those folks who have lived that life, who have been homeless, are currently facing homelessness, that they have a seat at the table. They are experts at this, and we need to listen to what they have to say, and that'll help. I think that'll help propel success. I think it'll keep us moving in the right direction. We just have to listen to everybody. There are partners in this, and there's no us and them, so let's invite them to the table.
Thank you, Jan.
I'm trying to think how to add to what has been said. I guess I would say if we have realized an end to homelessness, we can keep working our way further upstream and abolish poverty and discrimination and kind of work on some of those other big issues, the complexity of all of them that builds the constellation that results in homelessness. We'll just keep working our way back.
Thank you, Sarah. You heard it here first, abolishing poverty. Pam, is there anything that you'd like to add, especially maybe in terms of the behavioral health sphere? You know, how would just our community's ability to lift each other up really improve that service delivery as well?
Well, I'm sure everybody already knows what I'm going to say, which is that, you know, behavioral health to really be treated on an equal footing with physical health is going to be significant if we're going to see an end to any of these concerns. And I also want to say, though, that I already mentioned this, but being able to look at how we can do things in a creative way in a state like North Dakota, where we know that people care about neighbors and we know that we care about our community, it's really important to be able to find creative solutions. When I talk about, you know, ensuring that people with lived experience are treated as equal professionals to every psychiatrist or psychologist or mental health clinician, those are things that are really important, because we're never going to have every community in North Dakota have access to those types of resources. So we have to be a community that cares about each other. I grew up in a really small town in North Dakota, graduating class of 5, 3 of them first cousins. Whoop, whoop. I just have to say that the one thing that I always come back to is we genuinely cared about each other. And having that connectedness of community is something that's culturally just really, really relevant, whether you live in a larger city or a small city. If somebody was going to smoke a cigarette, somebody was going to call somebody's mom. And it's those type of protective factors that make us a strong community, and it's actually what makes our culture really strong in our state. So to me, those are the things that I always come back to, and it's those core values that drive how we treat people and how we treat each other.
I thank you so much for that answer, Pam. I don't know if you all can feel it, but I'm feeling the love up here from everyone. I really think, you know, what Pam's kind of asking us is, can we love each other enough to end homelessness in our community? And I think that our values show that, yes, we can and we do. So let's make good on that. Okay, now it is time for us to open this up to questions from the audience. We have a few volunteer mic runners who are making their way down to the stage. It's difficult for me to see up here if folks are raising their hands, but you can direct a question to any of the panelists, all of them. But we really want to hear from you and answer the questions that you have about homelessness, about what's possible in our community, or some of the specific services that our panelists provide.
Thank you for everything you've said. This question's for James. James, when you did your city did the placement, I'm really curious about how you dealt with the social networks that are created in the houseless community, the homeless community, and that sometimes when they're pulled out, those networks are broken and it becomes very challenging for the individual who's no longer in connection with that support system. How did you address that?
That's a great question. So it's especially important. A lot of what we did in our housing network was what we would call scattered site. So homeless individuals would get a rent assistance voucher and they would choose where they go. It's not just a building with services in one location. We wanted the people that we serve to have choice in neighborhoods and things like that. It does make that socialization issue a lot harder though. So we definitely rely a lot on peer support specialists, which are individuals with lived experience. But also, what was important to us in the film, Jeff had mentioned the advisory committee. So we have a resident advisory committee that's formerly homeless individuals that were homeless for a long time that are now in housing, and they will do visits to people's apartments. They will get them active in socialization. They will help kind of run our social events for everybody in our Housing First program. So we really relied on individuals with lived experience to actually go to people's apartments and get folks involved in more social issues. Isolation is a huge issue that we need to talk about, and it's certainly linked with behavioral and mental health as well. I appreciate the comment. A lot of folks don't really talk about the isolation aspect of what we're dealing with, but it was really individuals with lived experience that were kind of in charge of the socialization and isolation issue. So thank you very much for the question.
Thank you all for being here and discussing the many reasons we have to be very proud of the FM Coalition for Homelessness Prevention and the partners working with them. But I haven't heard any role for the state or for the state legislature. And what can the state be assisting with in the community in the way of law changes, appropriations, additional services that would add to the community's efforts? And I know Pam Sagness is, besides being a talented professional and a great advocate, she's also a good messenger. So maybe she would take some of these ideas that the panel can give her back to Bismarck.
One thing that I would really love to see is going back to evictions and eviction court. About almost 100% of landlords have legal representation in that courtroom. Close to 0% of the individuals that we work with have representation or any kind of legal assistance on the North Dakota side. There's a lot I think we could do, and James had mentioned this earlier today, and I know not everybody was there for that presentation, but I believe it's on City of Fargo's Facebook page, so I'd encourage, if you missed it, people to check it out. But right to counsel is a really important move, I think, that North Dakota could take to provide more protection to help people. I think there's pretty small tweaks we could make to tenants' rights that would give them some more time to pull together resources, that would give them some more opportunities to locate and work with free legal aid. And what all that might entail, I would need to spend some time or learn from James about, but I do think it is an important next step that North Dakota could take.
I would also, since we're at the wish list portion of this, one of the things I'd like to see more at the state level across the country is the investment in affordable housing. Every single community in North Dakota needs more housing units. If you look at the vacancy rate that you're dealing with in Fargo at under 4%, every community needs more housing. So I would love to see at the state level more financing mechanisms, more tax credits. It's certainly being talked about. That's going to be growing at the federal level. But to have more states involved in gap financing for the development and the construction of affordable housing is needed like yesterday.
I think I can articulate this question, but I remember visiting the Department of Health and Human Services in Washington, D.C., and seeing a quote that was attributed to, I think, Hubert Humphrey, who's, our neighbor state, Minnesota. And essentially what he said is that a mark of a civil society should be measured in its greatness by how it treats its most vulnerable among us. And that's really what we're talking about here. And you all represent so many different services that are providing great things for the vulnerable among us. I also think about the definition of insanity, and that is, doing the same thing over and over and expecting a different result. And as I listened to you, James, this afternoon, I heard something that I think might break us out of that insanity, but I'm not sure. And so my question is to you, and that is, and I saw it in the film tonight too, and there were a couple of things. Today, you were asked, how do you get that going? How did you get it going? And you, in essence, said what I saw in the film. You got up and you just kind of started mapping it out, and this is how we need to do it. And then you got buy-in from your county executive, and I heard your county executive say, I won't be the wind beneath your wings, I'll be a frickin' hurricane. And what I heard from you and what I heard from him is, you need that one person who is going to stand up and say, let's do this. This isn't as hard as we thought it was. We can do it. And so my question to you, James, is, am I seeing that correctly? And then the second part of that question is maybe to everybody here, or you, James, have you seen that executive here in North Dakota that will say, I'll be the hurricane under your wings so that we can get this moving?
Great question. So I would say I've spoken in several communities across the country and even in Milwaukee. What the mayor's office has done, I have never seen crowds like this. I've never seen this much interest. We had senators and reps in county and state. I have never seen that. So this is the first community I've seen this kind of buy-in, these kind of crowds like this. Seriously. So. Thank you, Mayor Mahoney and your whole team, and Jan and the work you do. But I'm not used to seeing this. So I did put that in one of my slides before. A lot of this, especially when you're talking about working with government, but also businesses, and how do you take these divergent groups and put them together? It is about accountability. So if we're going to talk the community into refreshing this and looking at it differently and holding each other accountable to reductions in homelessness, there does have to be somebody in charge, and maybe not 13 or 14 different people and task forces and all that. I would love to see whoever that is going to be. Each community is different. For us, it happened to be county government. It could be city government. It could be a nonprofit. Each community is different. But I would strongly recommend someone kind of lead the charge and take the bull by the horns here in Fargo and really lead that from a leadership perspective.
In Milwaukee, when you guys did this housing first, did you guys rely a lot more on finding, I know not all landlords will take housing vouchers, for example. I think a lot of times it's more independent landlords that are more likely to work with you to find housing. Did you end up having to build more housing, or did you just happen to have more agreeable landlords that you could work with? How did you guys go about actually creating or finding the housing for people? So that's my question for you. What did you do in Milwaukee? And then I'm wondering for the rest of the panel, what that might look like for us here in Fargo, whether we would need to construct more housing or if we're, and where that would be. I know one of my frustrations every time I talk about this with people in town is no one wants it near their homes or their families, but our unhoused neighbors, they have families, they have kids as well, and you know, like everyone deserves to have a house, and it's got to be somewhere, so why not? You know what I mean? Like, what did it look like in Milwaukee and what could it look like here?
Sure. So it is definitely both. So Fargo, I think the mayor was talking about shortage of 15,000 units of affordable housing. So that has to get done in Fargo, but that's going to take a long time. So we talk about short-term emergency type goals that we need to do here in Fargo, but the long-term goal of developing that housing. So no different in Milwaukee. We've done thousands of units of affordable housing, but the biggest thing is there are existing resources in communities that you just need to retool and find efficiencies. So for us, we're fortunate enough in our housing division, our county's housing authority is a part of our division, and I'm the executive director of that housing authority, but also linked directly to our Housing First program. So we put a homeless preference in our housing authority, really laser focused on giving our outreach team what Jan needs and her team needs is immediate access to housing. So we gave our outreach team that immediate access to housing with existing vouchers through our rental assistance program, as well as some local investments, and have it be scattered site with landlords that already have units. Again, it's harder in Fargo and in Milwaukee now with our vacancy rates. It's a really competitive rental market. But a vast majority of our progress was done with existing housing. Existing housing is here right now in Fargo. We just have to figure out, talking to your housing authorities, what local investments there can be and to best utilize existing housing. We talked earlier today about master leasing with the idea of the city of Fargo or somebody being a leaseholder to move people directly into housing as quickly as possible. So you have to look first at your existing housing while you build the affordable housing moving forward. So happy to turn it over to anybody else with comments.
Just a quick question about, you know, what that looks like. You talk about, you know, most people sitting at the table with, and I was wondering, like, in your program, how did you initiate all that? I mean, get the homeless and the community to start working together and holding each other accountable. And, I mean, get action. I mean, because a lot of people, you know, they get offered services, but they don't do it. There's no follow-through on either side. Or you get left sitting in an empty apartment and, you know, you lose it because the services stop. And bridging the gap of, I mean, youth homelessness to adult homelessness. And obviously, you know, a lot doesn't work. I mean, you know, in certain places, you know, the communication between the homeless and, you know, I mean, service workers. And I was wondering, how do you initiate that? Get homeless people and, I mean, types of people sit down at the table and seriously talk. I mean, what, you know, and obviously probably take a shower and put on clean clothes to start with, but, you know, oh, never mind, that's an inside joke. But anyway, that's all I have right
now. As I mentioned earlier, I think one of the things that we have to do better, including in the programs that I'm responsible for, is making sure that everybody that we serve has the opportunity to come to the table and talk about solutions. You know, I think that it's going to be 16 years next month that we open the Gladys Ray shelter, and I know probably even some people in this room weren't so sure if that was going to last. The smartest thing I think that we ever did as staff is ask the people that showed up how to do it. They were the experts, they knew things, they knew what was missing in the system, they knew what was flawed, and they knew what they thought would work or what had worked somewhere else. They'd been in so many different shelters, far more than I had ever been in. And so I think that we have to figure out, I don't even think it's that hard to figure out. We just have to have you guys at the table. It's the best way for us to learn is ask the experts.
Just to add to that, so one of the things, thank you for the question and the comments. One of the things we did in Milwaukee, again, I mentioned the Resident Advisory Council. So for us, it's not just about having those with lived experience at the table, it's actually giving them the power to affect change. So for us, when we do our request for proposals and contracts in county government in our housing area, formerly homeless individuals on our advisory council are on our scoring panel. So they're actually at the table scoring nonprofits and directing those funds along with us and our staff. And we pay those individuals for their time as a part of that review process. So it's not just, talking about people being at the table, it's actually empowering them with decision making. We've changed a lot of our programs based on the comments from our Resident Advisory Council.
Bonjour, James. Welcome to the land of the Anishinaabe and the Oshete-Shukoan. And earlier today, you talked about a gentleman who had been homeless 20 plus years. And from my understanding, you're a data-driven organization. What are the statistics thus far with people like him continuing to stay housed? And I'd also like to add, when Fargo starts their advisory council, I throw my name in there. My name's Tracy Wilkie. I was born 56 years ago in Fargo into homelessness and struggled with it throughout my lifetime. So, yeah, if you'd let me know the stats, thank you.
Sure. Thank you for sharing your story. I appreciate that. So our statistics, so with Housing First, it's all about permanently ending someone's cycle of homelessness and retaining housing. So that's an important conversation here in Fargo. So individuals in our Housing First program, we have a 97% housing retention rate, which means 97% of the participants doing True Housing First never return to homelessness again. So it doesn't necessarily mean an individual is going to move into their first ever apartment. One of our clients, you heard, she was 38 with her first apartment. It takes a while to figure out how to live independently like that. Maybe the first apartment won't work. It doesn't mean an individual returns to homelessness. We try it again and we try it again, and eventually it works. We don't discharge people back into homelessness in a True Housing First program. So we're at right around 97% success rate for people maintaining their housing.
So the issue at the root of homelessness seems to be rocketing rent prices. How do we stop that issue from continuing to increase? Is imposing a unit vacancy tax on landlords to encourage them to prevent evictions on the table? How do we get that started? Who do I bother about that?
Who wants to tackle that one? What I will say is that the state of North Dakota did ban rent control in the 90s, and that is a difficult thing to work within. So we have to get really creative about how do we figure out how to have that same result of a more affordable rent price without imposing rent control. There's ways to do it, there's subsidies, there's things that you can do. But I don't know that most people know that. I did not know that for a long time. So I just wanted to mention that before the other smarter people answer that question.
Well, yeah, I don't know about all that, but the two things I'd say, number one, it is certainly about supply and demand. When you have this much of a lack of housing, it's driving rents prices up dramatically because we don't have the housing stock we need. The other thing I would say is, we're very active working with landlords. So we have a person called the Landlord Engagement Coordinator, and his only job is finding new landlords, developing new relationships, and frankly, we compete for units with the rest of the market for the people that we serve. There's not a lot we can do about rising rent prices, but talking to landlords about the benefit of working with us, how we can benefit landlords and pay double security deposits and do these different types of things. We've been able to build trusting relationships with landlords where a lot of our landlords don't even have to talk to our tenants. They come directly to our landlord engagement coordinator, who talks more like a property manager than he would a social worker. So we honestly compete in the market just like regular renters for those units, and it is extraordinarily difficult with rising rents. But it's really kind of these creative solutions with existing landlords, and hopefully here in Fargo, just like in Milwaukee, there are landlords that want to do the right thing. And you have this new approach to homelessness, and they want to be a part of that, especially large property management companies that, being in Fargo might mean a lot to them and be willing to do this and set aside units. But a lot of it is just competing on the open market with our landlord engagement coordination staff.
I really appreciated the who do I bother about that part of the question. I would also just say, please email our city commissioners and our county commissioners. They are listening to you. I know because they ask me questions about the emails that you send. And so please, please do talk about what your good ideas are, what you think might work in our community, because they are listening to you, and it's part of why we are where we are right now talking about this, is because the community has shown that this is something that they want addressed.
I did street outreach for the homeless population in San Francisco and Minneapolis for a few years. And they were primarily youth, and what I noticed is that most of them, or at least probably more than half, were LGBT youth. And I know that we've described tonight North Dakota being so loving and accepting, but what I viewed is increasing hostility and contempt for that population by our state leaders and, frankly, by many of their constituents. So I just wanted to make that comment, and I don't know if you have any, if you want to comment back. I just needed to say that. Thank you.
Would you share with us how it is that you engaged the street-level storefront business community in your work? We saw the bid director for downtown Milwaukee several times in your film, and you've mentioned a couple of times how business was involved, but I don't see a lot of business representation tonight, and I'm wondering how it is that we can learn a bit of language on how it is that we work with our business community to be part of the solution rather than, off to the side or wherever it is they are.
Yeah, great question. So maybe and hopefully one of the reasons you might not see a lot of business owners here is I'm meeting with them tomorrow. So we're having a separate session just with downtown business owners to discuss this topic, have real conversations, challenging if they need to. Businesses need to be a part of this conversation and solution, especially it's the economic driver of Fargo is going to be downtown Fargo. They need to have a seat at the table. So for them, what it was in Milwaukee is, business leaders wanted to do the right thing. They wanted to have empathy for the people we serve, but they demanded results. They wanted to see downtown look dramatically different. And what it was for them, again, just visually, and the optics of downtown changed very, very quickly with our program. We started working in downtown. All of a sudden, the encampments that business owners saw were gone. They wanted to know why and what that looked like. But a lot of it for our business owners is, they wanted somebody to call quickly, not have to necessarily call law enforcement, not be dealing with the same problem over and over again. So the ability of our downtown outreach worker, if they get a call from the steakhouse downtown or wherever it happens to be, within a few minutes we can respond to that call and be receptive to those business owners. We meet with businesses every week. We go to all the bid meetings. And we're very active and we respond quickly. So I think just the presence of that and that fast response, and certainly the very large decrease in downtown homelessness was part of it, but it was about us showing up, listening to business owners, and be able to respond to their needs really quickly. That helped us.
Hey, I just have a question. When you were talking about the decriminalization and stuff in the very beginning, that's really great for someone like coming into the system and stuff like that, but can you talk at all about, say, individuals who have felonies or criminal records from the past, have cleaned up and kind of turned their life around, how they're still experiencing homelessness and how they could possibly get into services or things now at that stage in their life?
Sure, so I'd say a couple different things. So number one, that's where our landlord engagement coordinator comes into play to try to find landlords that are willing to look past some of those challenges. The other thing we did, so landlords can certainly do all the background checks they want. One of the things we did in our housing authority, we eliminated all of our background checks. Landlords can do their own, but a lot of housing authorities double up on that and do their own background checks, and we waived all that because that was a big issue. We also kind of mentioned the idea of master leasing, where we're the ones at the county kind of deciding who's going to be using those units. So a lot of times if individuals are not going to qualify for certain types of voucher programs because of their background, we take that on and we're almost the tenant, working with the landlord kind of in that master lease situation. There's been a lot of conversations about maybe expanding that and starting that up in Fargo. So that's one of the ways that we do that. We're never going to screen individuals out of our housing process because of their background.
All right, I know we have a few people who had wanted to ask questions. I would encourage you to stick around and try to catch one of us as we wrap up. We are certainly more than willing to continue this conversation. In fact, this is just the beginning. And so we're really excited about where we'll go from here. Can we just have one quick round of applause for our panelists? All right, and I'll turn it over to you, Mayor Mahoney, to close us out.
Thank you. Thank you, everybody, for showing up. I think what we were surprised, and James was pleased as well, is the crowds we had today. And we really felt, one of the things I loved that he said earlier this morning, I love the energy of this community. And that is what we need. I think James Mathy has been a catalyst for us. It'll be a ignition point that sparks community-wide effort to end chronic homelessness. We learned today many techniques that you've utilized in your area that we feel will work here. And I think it's our goal as a community to attack this problem best we can. This morning we had leaders from North Dakota, Minnesota, cities, county, all throughout the system, plus state representatives as well. And we feel there's a huge interest in this problem, and we feel we'll be able to work at it very hard. It is truly a priority of our community to attack this issue. And we feel we have the talent, the people that can get after it, and we can make marked success. I would love to come on this stage in 5 years and say we have gotten control of chronic homelessness. I think, Jan, that's been your dream all along, and that's what we'll continue to work at. So what we want to thank all of you for being part of this, and we all are going to be part of the solution. We all working together can take this on. And we're kind of a pesky little community. If we take something on, we oftentimes come to success, and that's what we're going to come to on this issue. So thank you, everybody, for being part of this. James, you've been very cordial as far as staying around and answer questions. So if you can wear them about 10 o'clock, then we'll shut it down. But no, he's been very good about answering questions and very good with the crowd as well. But he gave us some interesting tools today when we talked about this problem. That's part of what we hope to get out of today. So if we can look at all the notes we've got and all the different things we've got, we feel we have now a little bit of a chest full of tools that can be utilized to attack this issue in our community. And I did like your thought, relatives are often your sisters, brothers, sons, daughters that are in our community. And it's not those people, they're our people. So we need to really work on that, and that's what we will do. So let's give a round of applause again for the team, and appreciate it.